Imagine you're about to undergo surgery. The operating room is bright, the staff is bustling, and you're feeling a mixture of anxiety and anticipation. Then, a calm voice reassures you, "We're going to give you something to help you relax and drift off." Moments later, you're unconscious, unaware of the procedure, and when you wake, it's all over. This remarkable process is made possible by anesthesia, a medical marvel that has revolutionized surgery and pain management. But how does anesthesia actually work? And what instructions must be followed to use it safely? Anesthesia, at its core, is a method to block pain and sensation during medical procedures. There are three main types: local, regional, and general anesthesia. Local anesthesia numbs a small area, like when you get a cavity filled at the dentist. Regional anesthesia blocks sensation in a larger part of the body, such as an epidural during childbirth. General anesthesia, the most complex, renders you completely unconscious, allowing surgeons to perform intricate operations without causing pain or distress. But what's happening inside your body when anesthesia is administered? Let's focus on general anesthesia, the type most commonly used for major surgeries. General anesthesia is typically delivered through inhaled gases or intravenous medications. Once inside the body, these agents travel to the brain, where they disrupt the normal communication between nerve cells. Our brains are like vast networks of electrical signals constantly firing to keep us awake, aware, and responsive. Anesthetics interfere with these signals by enhancing the activity of certain neurotransmitters that inhibit brain function while suppressing those that excite it. The result? Consciousness fades, awareness disappears, and pain signals are blocked. Administering anesthesia is both an art and a science. The anesthesiologist, a highly trained medical professional, carefully calculates the correct dosage based on your age, weight, medical history, and the type of procedure. Too little anesthesia, and you might wake up during surgery, a terrifying and painful experience. Too much, and vital functions like breathing and heart rate can be dangerously suppressed. This is why anesthesiologists constantly monitor your vital signs: heart rate, blood pressure, oxygen levels, throughout the procedure, adjusting the medication as needed to keep you safe and comfortable. Before anesthesia is given, there are important instructions to follow. You'll often be told not to eat or drink for several hours before surgery. This is because anesthesia relaxes the muscles that keep food and acid in your stomach, increasing the risk of aspiration when stomach contents enter the lungs. Fasting reduces this risk, making the procedure safer. You'll also be asked about allergies, medications, and medical conditions. Certain drugs can interact dangerously with anesthesia, and conditions like sleep apnea or heart disease can affect how your body responds. Providing accurate information helps your medical team choose the safest anesthesia plan for you. Once in the operating room, the process begins. An intravenous line is placed in your arm to deliver medications. Sometimes, a mask is used to help you breathe in anesthetic gases. Within seconds, you feel drowsy, your surroundings blur, and consciousness slips away. During surgery, the anesthesiologist remains by your side, adjusting medications, monitoring your body's responses, and ensuring you remain safely unconscious. But anesthesia doesn't just turn off consciousness like flipping a switch. It's more like dimming the lights in a complex, interconnected system. Different anesthetic agents affect different parts of the brain and nervous system. Some block pain signals, others induce sleep, and still others relax muscles. This combination ensures that you're not only unconscious, but also free from pain and movement during the procedure. When the surgery is finished, the anesthesiologist gradually reduces the medication, allowing your brain to resume its normal activity. You emerge from anesthesia in a recovery room, often groggy and disoriented. Nurses monitor you closely as the effects wear off. Some people experience side effects like nausea, sore throat, or confusion, but these are usually temporary. The use of anesthesia has made modern surgery possible, transforming once dangerous procedures into routine operations. Yet, it's not without risks. Complications can occur, especially in people with certain health conditions. That's why following pre-surgery instructions and communicating openly with your medical team is so important. Thanks to anesthesia, millions of people every year undergo life-saving and life-changing procedures without pain or memory of the event. It's a testament to the power of medical science and the skill of dedicated professionals. So the next time you or someone you know faces surgery, remember the intricate dance of chemistry and care happening behind the scenes, ensuring comfort, safety, and a smooth return to consciousness.